You must be careful about the words you use, or the words you allow to be used in your house. Words are things. You must be careful. Careful about calling people out of their names, using racial pejoratives and sexual pejoratives and all that ignorance. Don't do that.
It's time to talk about it.
Pull up a chair and take a seat.
We're serving up recipes for life.
With Hampton University's Dr. Richard Mason and Dr. Tamara Williams.
Welcome to the Sunday Brunch.
This is Dr. Tamara Williams.
And this is Dr. Richard Mason, and welcome back to the table for another edition of Sunday Brunch with the Good Doctors. How are you doing?
I'm doing well, brother. How are you this week? How are you?
Listen, I'm doing good. It's been a good week, a short week, but a busy week. So that's it's a good and a bad thing. So
we cram the most. We seem to cram so much into our week. Probably what 4 or 5 people do, we cram into our weeks, but we wouldn't have it any other way at this moment. So
not at all. I tell folks, always trying to find another hour in a day.
Let me know when you locate it. That's gonna be some good knowledge.
When I find that $25 bottle of 25 hours, I'm a certainly sell it. You hear what I'm saying?
Indeed. We'll add that to the show for sure. It'll be our first product that we'll be selling from the show.
Listen, because I'm telling you, if people could get one more hour in a day, I'm sure they'd buy it.
And all jokes aside, it's really about us making the most of the time that we do have. Mm-hmm. And that is reason why we do as much as we do in the days that we do it, because we're trying to make the most of the time that we do have, because there is no 25th hour. We only have the same 24, and we all get the same 24. Is what we choose to give our time towards that really makes a difference.
Exactly. And it's one of those things that you look at everything that you have to get done. It's just amazing to me how sometimes people waste time.
A lot of time.
And I guess for me, I don't say I waste time, but when I have downtime, I try to make sure I make the most of my downtime, because outside of that, I'm cooking with gas and firing on all cylinders most of the day. And that's one of the things that we try to, make every minute count, make every moment last, and do the best you can to live in each and every moment, because as I would tell folks, tomorrow is not promised to you.
Not even later on today. And so I tend to get up early and I go down early as well. A lot of people end up messaging me at night and I'm already gone. I don't find
I know.
Yes, you do know. My bad. I go hard during the day. So, I go down early. And I have nothing nice to say after a certain time of night. Like, I'm not thinking as clearly as I would like to be. So I'm at my best in the mornings. And so even though I'm not a morning person, meaning like I'm not calling everybody in the morning, I do my best thinking in the morning when it's quiet.
Well, I tell you, my creative juices will flow later in the evening once the house is settled, everybody's quiet, everybody's asleep. And that's when I tend to get a lot of stuff done. So if I'm not able to work, I'm taking notes, and so I'm making myself little mini notes to work on this the next day or something like that. I'm planning to plan sometimes, so
always that mode. Absolutely.
Exactly. Yeah. So that's what I'm doing. But I really, I'm not as much as of a morning person. And that's why I tell my students, when students would call, I would say, I want to give them, full access. And I would always tell them, don't call me before 10 o'clock and don't call me after 10 o'clock. That's my time. That is truly my time to get my life together, so.
And that's mighty generous, because you gave them 12 hours.
Mm-hmm. Yeah.
You better not, don't call me at 10 o'clock. Don't call me at 9 o'clock. And if you catch me after 8:30, you are a bad somebody. Shut your mouth, because I'm typically out of here on purpose. And so a lot of times, when we're talking about our 24 hours, we're talking about what we do on purpose. Something in our life we don't even realize becomes our purpose. Like we're not even purposely doing those things, but life happens to us sometimes. You know, people say you turn your mess into your message. I don't like to call people's life a mess.
Right.
I like to look at it more as things are happening, and some people are able to make pilot adjustments. So, you know, when pilots are flying, they're making thousands of adjustments in the air. They're not making any of those announcements that let us, because it would wig us out while we're flying if they told us everything they had to do to get us down safely. And so, life, we have to learn to make these pilot adjustments sometimes when life is lifing.
Exactly.
So that we have safe landings. So I'm excited about our conversation today.
Oh, yes. Because it's about making pivots. And so that's what we do. We learn to pivot.
Listen, stay on our pivot. Stay on our pivot. And when you stay ready, you don't have to get ready. And really, it's about how we learn to maneuver through life. There's some people who naturally fall apart and other people will fall in place. And so I'm excited about our conversation today because while things look like they were falling apart initially and could have fell apart, they were able to fall into place and be very beneficial to other people as a result of that too. So I want to welcome to the Sunday brunch table, Chastity Corbett from Social Butterflies Foundation. Chastity Corbett, welcome to the table.
Hello. Thank you for having me. All the conversations I was listening to about pivoting, I said, oh, that was my word for the past 2 weeks.
See how it's meant to be? People heard the good word. Now they can come and talk with the good doctors.
Look, that was confirmation. Yeah. That was confirmation.
Hey, and that's life. I'm going to tell you, learning how to pivot.
Yes.
You better or you will fall. You will hurt yourself if you cannot pivot.
Oh, yeah.
Because people
Exactly. And I was telling somebody the other day, you know, they were just talking about, of course, all of the weapons happening to them and this, that, and other. I said, listen, you know, you got to remember, the Lord didn't tell you that the weapons won't form. He said they won't prosper.
There's a difference.
So you got to learn how to pivot in that, you know, and that makes a big difference.
And people, so you got to tell them, get behind me, Satan, and don't push.
Look, I don't want Satan even behind me, get away from me. That's what I'm telling you. Don't even get behind me.
He's like, go on, flee, right?
But my grandma would say, go on somewhere.
That's right.
You better go.
You better go. You better go.
Have several seats. But we know those things are out there, and we're not exempt from life. Even as much as you're planning and you're trying to be as good as you possibly could be to yourself and others, life is still
something's going to come up that you got to just know how to manage and overcome. You can't let it just keep you in a rut, as grandma would say.
You got to get out that ditch. And what we know about blind people is the blind will lead the blind straight into a ditch. So at our table, we like to shed light so that our people don't have to remain blind so that we can see.
There you go.
That's right.
Yeah, that's right. Because I like to see what I'm eating.
I don't even just like to see. I like to smell it too. And I'm one of those weirdos, and I don't care what people say. If it don't smell right, I'm not eating it. So I sniff all my food too.
You smell your food.
You better know I do. You ain't never seen me do it as many times as we have brunch.
It gotta smell right. It gotta look right, and it better taste right.
That part over anything else. For me now, like I'm more of a purposeful eater, so I like things I eat for a purpose. I'm not just eating to eat. So I want it to taste well, but it doesn't always have to be fantastic. If it's something that my body needs, I'll go along with that within moderation. But got to still.
Oh no!
It still got the smell.
I ain't get there yet.
No, if
I eat it, I gotta make sure it better be worth going in my system. It better taste right.
All the things that are good for us don't always taste the best, though. So
that's right, because I don't eat beets, and they talk about all of the good nutrients of beets.
Beets are amazing. That's my right there. Oh my goodness.
The only way I do beets is if they're juiced. I have people put beets in the juice, and it's mixed with the other fruit, so I can't tell it's really beet.
Let me tell you, a beat has never blessed me. That's all I'm going to say. A beat has never blessed me.
You said the same thing about yoga. I don't know. But, as we age, things in our taste buds change and our life change. Like when I was younger, I didn't eat Brussels sprouts. Now I love them, so it really did. There's a couple things that don't change, however. I'm still not a fan of liver or chitlins. That's not happening.
Maybe if I fry a beet, can you fry beets? Maybe if I fry them, maybe add a little grease to the beets.
I think that would defeat the whole purpose, bro, of being healthy. That would defeat the whole purpose. It's one of those acquired tastes, I guess. It's some people love it, some people don't. But Chastity, welcome to the table again. But I want to jump into your story because we can talk all day. This is just what we do. We can naturally have a conversation, but I want to make sure that we jump into your story so that we can share that with other people who may have people in their family that are experiencing some of those things too. Walk us all the way back to, I know you are a champion for lupus, but walk us back, if you don't mind, to how your first experience with lupus, how you learned about lupus in general.
Oh, goodness. I had just finished up my master's degree in criminal justice at Norfolk State University. Behold.
Behold. We don't have it.
Behold. And I was excited. My plan, tell God what your plans are. My plan was to finish with my master's because they did a fellowship. So I had a full free ride for my master's and then go to law school. But I ended up with a rash on my arm that summer, like around the end of May, that just did not want to go away. And I'm like, I don't put hydrocortisone cream on it. Been to the family practice doctor. They prescribed something stronger. Still wouldn't go away. So then finally my family practice just said, look, you just need to go ahead and go to the dermatologist. So I went to the dermatologist and he just took like one look at my arm and was like, oh, I got a feeling I know what this is. And I'm like, what? He said, I'll tell you later. I'm looking at him like, what? He had his nurse set up a little tray and everything, said we're going to do a skin biopsy. I ain't never been cut before. So I'm like, you about to do what? This man cut me. And I came back to his office. I had to go back to his office a week later. And he told me that it was lupus.
Do they cut you where your rash is? You got,
Yeah, he cut me where my rash was to do a biopsy on it.
Okay.
And the biopsy showed lupus. But at that time, they thought I just had what was considered discoid lupus. Discoid lupus is the type that primarily just affects your skin. You're real sensitive to sunlight. The sun could, cause rashes and fatigue and everything else and a flare. So he gave me some Plaquenil. I looked it up. I said, okay, this thing is old. They used Plaquenil back in the day to treat malaria.
I was
malaria. So I'm like, why is he giving me something, And then, of course, I go to the Google and I'm looking up lupus and I'm seeing all this information. I was just totally overwhelmed with the information, the things it was saying.
Who had lupus?
At that time, the only person we have found out, which was after my diagnosis, is that my great-grandmother, they discovered her lupus, but it was already too late. She passed away. So nobody else in the family that I knew of had it. I didn't know anybody in my circle that had it. It's a word that just never came up, So what do we do when we don't know something? We go to the internet and look it up.
That's a good thing.
Right. It was a bad thing. I looked it up and, back in the day we had three-way calling. So I'm on the phone with my mom, my sister, and all three of us just boo-hooing, crying because I said, at least I know where I'm going to die from, And we just started just crying, having one of those good old sessions.
That's a conversation, right?
Yeah. And then it was like I come from a praying family.
All right.
And my grandmama won't having it.
Oh, yes.
So grandma, rest her soul, she's like, we don't claim nothing, and you're gonna be fine. And we pray God got you. And I'm like, okay, so you okay, grandma. You pick yourself up. You do what grandmama says.
Right.
Indeed.
And yeah. And so then I found out I had to go see a rheumatologist. I looked up rheumatologist. I didn't know what that was. All these terms are new to me. And I said, okay, rheumatologists treat people with arthritis and stuff like that. So they treat old people. I ain't old.
But I heard pain that's associated with lupus.
Right. So I went to the rheumatologist. He told me just to keep taking the Plaquenil. Didn't really provide me with any kind of other information or resources that would help me. I looked around his office. Everything was just so antiquated. I'm like, good Lord, this man got his daggone degree in 1973. I was born in 70.
Oh, Lord.
Okay. So I said, no, he's not working for me. So we looked up another rheumatologist, and there was one across the bridge. I said, oh, I got to go across the bridge to go see this doctor. And he pretty much did the same thing. He did not spend any kind of time with me to explain anything. He just said, just keep taking the Plaquenil. Everything's going to be okay. I'm like, okay. So then as time went by, I started losing a lot of weight. I couldn't keep any food in. I started having these floaters in my eyes. I'm calling him like something's wrong. I can't eat. And he's like, well, don't stop taking the Plaquenil. I'm like, what is up with this Plaquenil?
Oh, yes, indeed.
So I kept taking it until it got to the point where I went blind in my left eye for like 5 minutes.
Okay.
I said, So then I had to go see a retinal specialist.
When you say 5 minutes, Chastity.
Yeah, it felt like forever.
You literally mean it was a 5-minute period. Okay.
I could not see.
That's a long time to go from sight to not see the panic. Yeah. Enough time to panic.
Oh, I panicked. I panicked because I couldn't see.
Yeah. 5 minutes to do it.
Yeah, and then you had that amazing grace. It's like, ooh,
that's a praying time right there. I can imagine a praying 5 minutes.
Man, and so the retinal specialist told me, that the Plaquenil can cause vision problems in people. So
the Plaquenil causes vision problems?
Yes, it causes problems with your gastro system and your problems with your vision. So I ended up having to get a gastroenterologist. They took me off the Plaquenil, but the doctor was insistent on me staying on the Plaquenil. And I did what the other doctor said, just, I don't want blind. My stomach's messed up. I like to eat. I can't eat. I'm not taking it.
And you said you were losing a lot of weight.
Lost a lot of weight. To be very frank, I went from like a size 14 down to a size 6'8".
That's significant.
In a matter of months. The doctor didn't bring me in to do any kind of examination, check anything. So, I was about done with him. And then I went back to my family practice doctor that January. And I told myself I'm having a hard time breathing when I sleep. When I lay on my side, it hurts. So he did a chest x-ray. And then he said, I need you to go to the emergency room. I'm like, okay. So I went to the emergency room. I get there. They hooked me up. Told everybody they need to put that mask on. And I'm like, what's going on? And they said I had pneumonia as well as a pulmonary embolism. And they was taking me straight upstairs to admit me. I didn't know what a pulmonary embolism was. Again, a new terminology for me. So they had to explain I had a blood clot on my lung. I said, oh, wow. Okay.
Was that the side effect of the medication?
No, that was, we found out that's because I didn't just have discoid lupus. I had systemic lupus.
It was starting to attack your organs in your body.
Right. So systemic lupus affects everything any and every organ, your blood, your skin, everything. And so at that time, mine was affecting my blood because I coagulate.
Mm-hmm.
So they put me on blood thinners. And told me I'd be on blood thinners for the rest of my life.
Wait, you take those blood thinning shots now?
Yeah. From 2006 up to today, if I go without a blood thinner or anything, I'm hoping there's some kind of food out there I could eat. My blood would clot up. You know, since that first blood clot in my lungs from 2006, I don't have blood clots in my legs, my arms, my chest. So I really have to be careful. And they had to switch my medication a few times because originally they had me on a Coumadin. Coumadin, I didn't like the fact I had to get my blood checked every week to check my PTINR. And I really didn't like the fact I couldn't eat my green leafy vegetables, which meant no collard greens. I'm like, oh no. So then my body got adjusted to the Coumadin. So they had to put me on Lovenox shots.
I've had Lovenox, and God bless you. That is not for the faint of heart.
You got to get a shot every morning. So they switched me from Lovenox to this different one called a Rixtra because of insurance companies. Apparently, Lovenox got to change to a tier 4 or something medication, and Blue Cross Blue Shield didn't want to cover it. So the doctor found a comparable one. And so that's what we did. But, you know, it didn't stop with the pneumonia and the PE. It was like as soon as I got out, I had to go back in the hospital because I had meningitis and a mild stroke.
Wait a minute.
Yeah. 06 was bad. Yeah.
When we had a conversation and I met you at your events, I had no idea that all of these things were aligned and wrapped in that. Most people have no idea who they're sitting with. They have no idea what people have been through. They have no clue. We do not look like what we have been through.
Thank God.
You said meningitis and a stroke.
Yeah, meningitis and a stroke at the same time. I said my thing like to come in twos or something. But, you know, because I was, at that time I was at Mary Mac, because I was at the hospital, that's where I met the rheumatologist that actually, I tell him to this day, you saved my life.
Oh, wow.
I finally got a rheumatologist that takes the time to listen to me, to figure out what's going on. He'll even walk around with his little recorder, like, you know, I have his cell phone number. That's how good of a doctor he is. I call him my daddy doc, you know, so.
He too was born earlier in life. You were able to appreciate his wisdom in a different way than the other doctor that got you.
Exactly. So he helped me navigate all these years. Every challenge that came up, he actually took the time to try to figure out what can we do. We're going to fix this. We're going to work this out. So I'm just so thankful, you know, for him. Because I did end up having a major epilepsy attack shortly after I recovered from the meningitis and mild stroke. And so it's like, okay, now I need a neurologist because...
You started seizures?
Yeah, I never had seizures before. That was my first time. The lupus brought all that on.
Wow.
Yeah. So my lupus affects my blood, my brain, my gastro system, my joints, and my skin. But God, so I just keep on pushing on. He ain't done with me yet.
You do. No one would ever know as much as you do. Like, we know you're a lupus warrior. I've seen your events out there, but I had no idea. And I knew that you had your own personal story, but you wouldn't know how many different layers that it was. It's not just having lupus. Lupus is like a gateway to having many other things.
It is. And it's also, people need to be mindful of the medications they take, the Plaquenil. And then I ended up getting put on prednisone, which is a steroid. But prednisone helps with the inflammation because when you have an autoimmune disease like lupus, you get a lot of inflammation in your body. And so there was times where the prednisone started causing me to have back problems. So they would give me an epidural injection, what you call, those things.
Oh, baby.
And let me tell you, I learned more from all my little visits to the hospital and doctor's office than I could have been in medical school, honestly. So it's like I ended up with what they call it, steroid-induced diabetes a couple of years ago.
Steroid-induced diabetes.
Yes.
Who knew that?
Now that is a new one.
I thought that was something you just got from grandma.
Child. Yeah.
Passed down from generation to
because
generation.
Because you take the prednisone is having you gain weight. The steroids.
The steroids, they will also mess with your bones. They will have you go and fluctuate, and you'll get the little puffy face, so your weight will go up and down. My doctor told me, I said, I keep craving onion rings. I had a craving for onion rings. He said, "Damn, the steroids, that's you. You got to have more discipline." I'm like, you make me sick. But,
right.
He wasn't lying.
I was going to ask that question.
If you were pregnant, that stuff could have been made. And when people are pregnant, they do have cravings. Our mind probably can jump and leap very quickly.
Lord. But I got the diabetes in remission. Once they told me you had diabetes, I was like, oh, heck no. Richard knows how much I love to bake. I got to bake. Yes. That's my stress relief.
Wait a minute.
So
love to bake and can bake.
And there is a difference. She loves to make things, and people love when she makes things. That's what you're saying.
Most definitely. I'm a witness.
See, I made cheesecake a couple of weeks ago.
All right. Look, it's about time for another one of them girls got them lemon cookie cheesecakes.
What?
Oh yeah.
Let me find out. You see, I'm perked right on that. What you talking about?
I'm telling you, yes.
That's my stress relief.
Came about. That's what the doctor was talking about.
Yeah. But see, I like to see other people eat it and enjoy it. That's my stress relief, and that's my little pleasure. Right. I may eat a slice, but then I'm done with it. So beating the diabetes, that was like, that came from me having to give up like my carbs. I love pasta. It's some good rolls, So I had to give that stuff up and learn how to cut back and portion control. But it worked. I'm off the medication. My A1C looks great. I don't have to worry about it. So I'm like, good. We got over that hurdle. That's like that pivot, right?
That pivot is there. Did you stop having the steroids, or they adjusted that?
They lowered the steroids, but what happens with me and my lupus, every time he tries to lower my steroids, my lupus attacks more. It goes into attack. Like I've been through Cytoxan chemotherapy 3 times.
Wait a minute, chemotherapy comes along with lupus?
When your lupus is real aggressive, they use chemotherapy to try to put it in remission. I did my first 6 rounds of chemo in 2012. That had my lupus in remission till like 2014. Then I had to do it again, and that kept me in remission till 2018. 2018, that was my last time. And what year is it? I told them I don't want it anymore. I don't want it. They don't really have any good, they didn't come out with any medications to treat lupus until 2011. And they had this infusion called Benlysta. So I tried to Ben Lisa before I did that chemo in 2012, but Ben Lisa and me were not friends. After one infusion, I was down and out for the count. My doctor looked at me. He was like, "Oh no, we ain't trying that no more," because it was a new drug,
Right?
you know. And it just didn't take for me. Now they have it, whereas people could give themselves shots themselves. It works for some people. It doesn't work for others. I know others who broke out in these big old boils in their legs. So one thing I tell people, what works for you may not work for the next person. Everybody's body is different. But don't get discouraged.
Right.
You just have to keep on. You got to keep pivoting. You got to keep pivoting.
Well,
you know what works for you.
Pivots, yes.
Right. So basically, I've tried changing my eating lifestyle. You know, I tried vegan for 6 months. I'm gonna tell you, I went to smoke barbecue. I don't know why I did that, because those beef ribs came out,
and it was
it was a wrap. I had to go in.
I do it.
Ribs in my life right now. I don't chop the mushrooms. Give me some food.
Right,
yes.
right, exactly.
I'm thinking, does it alter your mood too? You know, because when I'm hungry, I'm not a happy person. But also when your body is going through things, you're mentally going through things. So I'm imagining that is also a challenge for your mood.
Oh yeah, you have mood
depression, anxiety could be associated.
All of it, all the above. I think for me, I was fine. And you know, in our family, Black families, we don't do the whole go to a therapist to tell me your business stuff. You keep that stuff in house. But at some point, you can't keep it all in house or to yourself, because once you start talking to your family, telling them, "Oh, I feel bad," or this, that, you was just fine 5 minutes ago. What's wrong with you now? You know, so they don't understand what you're going through. So you need that outlet of someone to talk to that's non-judgmental. That you could get it off your chest and you don't feel like you're the problem. You know, so we even have children that have lupus and fibro. We have a support group for adults and the youth. And during COVID, that was like a really hard time for the young survivors, to the point where one of them was contemplating suicide.
When you say it was really tough for them, the isolation from others?
The isolation, not being able to have that, you know, just having that release, that opportunity to go and talk to someone else, because our immune systems are so compromised that we can't afford to be out in the public and around a whole bunch of people. You know, I had to cut back a lot of my activities. It hurt, but I had to do what was right for me. You know, I've had people invite me to stuff, and then when the time came, you never know what your body's going to feel like from 1 minute to the next. And if it's like, oh, I really can't because I physically cannot, they would get upset with me because I physically cannot. I'm like, don't you think I'm upset too? I mean, I want to go. I want to hang out. I want to do this and do that. You know,
too. So you found that sometimes it was isolating for you as well.
Yeah. I'm like, what happened to people saying, "Hey, let's make it a blockbuster night"? I know now it's like Netflix or whatever, but they don't do that. They don't say, "Hey, sis, I got you. I'm gonna bring some popcorn over, and we're gonna, you know."
We could have some of your cheesecake and have some popcorn.
Exactly. I'm gonna feed you because I like to cook.
Listen, say less, Soror. Say less.
Gosh.
We can't. I don't do sleepovers, but I'll pop in. You know.
Exactly. It's like, where they at?
I hear what you're saying. A lot of times people, which is one of the reasons why we're having this conversation. Sometimes people want to do something, they don't know what to do. Sometimes people they don't want to be not helpful, but they want to be helpful, but they don't know what is helpful versus what is not helpful. And so these are good things to say. Like, you know, sometimes people can't get out, but it doesn't mean they don't want to be around people.
Right.
That would like to have a day in or something that is focus specifically on them and their needs. Yeah.
Yeah, it's like
Closed mouths don't get fed.
they don't. And it's like, and I tell them, like, look, well, you could come over. Nah, girl, I'm going to this boat ride. I'm going to hit this cookout, you know. They gotta be out. I'm like, okay. Like, that's fine. It's all dandy cool. But you know, then I do have those that are my ride or die. My ride or dies, they're gonna come make sure I'm good. They're gonna say, Chaz, you know you ain't got no business where your cane at. You know you're supposed to have that knee brace on right now. What you been eating? I have those. You got that. You got to have that that little circle, that little small clip that's right there for you, and they do understand. They still gonna go to their parties, but they are gonna make sure you're good.
Right. They're gonna live still, and they're gonna be loud, but they're gonna also be cautious about what they're saying around you to make sure that you're included. Yeah.
They make sure. Look, my crew, they make sure. I call my ace boom coon. They make sure I'm good.
If they have to cry for a picture and pretend that you were there. Yeah.
Right. Oh, I had someone do that before.
That's good people right there. That's good people.
That's what I'm talking about. You know, they bring me stuff back, souvenirs.
Right. So you're learning to do life differently.
Exactly. You learn it. You prioritize things what's important to you, and like how you were saying earlier about you know, you giving yourself that time frame. Like, oh, this is my time frame. Don't bother me. But you good with 12 hours. For me, my office hours are from 9 to 5. Don't bother me after that. Because my body starts to shut down at 8 o'clock. I'm already in bed by 8. And
you talking about my life, I might need to be tested. I mean, to me, like, I'm like, Lord, she told me about myself.
Oh gosh.
Because I tell you, I'm going to sleep. I ain't playing with you.
Look. That's how it is. But speaking of testing, usually it takes people a long time to even get tested. It could take like 6-7 years along. Because
many different things, you don't know what you're tested for.
It mimics different things, and people have different insurances, and some insurance companies are not going to just have them be testing you for stuff just to be testing you for stuff. At least that's what they think about it in their mind, but that's not the reality of it. You know, you get your doctors usually do a regular CBC, so they can see what your white blood counts are, your red blood counts, but they're not testing for any kind of antibodies in your body. Like for lupus tests, they would do like an ANA test, and with that test, they can determine if you have any kind of autoimmune illness. And then they run some other tests to check different activity levels. So it's not an easy process. Mine was the easy process because the skin biopsy. But again, they only showed one form of lupus. It didn't show
all the and then everybody may not have that rash, correct?
Exactly. Everybody doesn't get a rash. Usually they'll say butterfly. The symbol for lupus could be a butterfly, because a lot of people would get a butterfly rash around on their face, just like a dark mark. I didn't ever get one around my face, but inside my ears, you can see a little darkness in my ears. So everybody's different. I'm like, no, I clean my ears. That's just
but the reason why you saw me look at you like that is because I'm thinking like, wow, that's something that people could miss easily. And when you think about ears in the African American community, we talk about when babies are born, we check the color of their ears to see what goes. And so I was thinking to myself, wow, you said in your ears, there's so many things that people need to check. So that normalizing things and understanding that it could be a sign or a symptom of lupus.
That's true.
Right.
That's true. Exactly. It's just so many different things that it can be. Like, I tell people all the time, people with lupus can have cancer. People with cancer can have lupus.
And we don't know which one came first, the chicken or the egg, apparently.
Exactly. Exactly. So it's like the only thing I could really suggest is pay attention to your body. If you feel like you're having joint pains all the time, you're getting a headache, and you
That
get
sounds like
fatigue,
aging.
you getting fatigue, or you easily get sick. And when I say fatigue, I don't mean, oh, I just ran a mile and I'm tired. Fatigue in someone with lupus is like you feel like you got hit by a truck, dragged up the street, and don't even want to pick yourself up.
Mm-hmm.
It's a different tired. It's a different tired altogether.
Right.
Like,
And people just need to be educated on this. Yeah, that's the thing, just to provide the education.
Yeah, that's why I do my best with that. Because honestly, in the beginning, I didn't really want to tell anyone. The only reason why I started telling, like my line sisters and everything, and started telling people is because if I was going to be out with them, I needed them to know in case something happened and I went to the hospital, so that the doctors could know how to properly treat me. And then once I started telling them, it was like, oh, well, I started sharing different little things on my social media. And that's when I started meeting people that said, oh, my aunt has lupus. Oh, I got lupus. I'm not alone. And it's like, oh, wow, I got some people out here, more people out here. But we got our own little community going on.
Did you see how she lit up Mason when she said, I have my people out here? Representation matters.
Right.
Yeah.
And you don't feel like you're alone in this thing, you know?
That's exactly right.
You're not alone. And so I started going to the larger foundations walks in Richmond every year from like 2000 and I'd say like 2010. I would drive up there every year for that walk, raise money. And then I learned that the money I was raising stayed in Richmond. I said, hold on, Hampton Roads, we need help. What about us?
We have lupus.
Right.
Exactly. So I started bugging the heck out of them. When I say I'm talking Dennis and Menace style bugging someone. Until they finally said, hey, would you like to chair our walks in Hampton Roads? I'm like, yep. So brought it. I got me a walk committee going, started doing those walks, bringing all kinds of people out, raising good money. And then they even asked me to start doing it for Richmond. I'm like, oh, okay. So I started helping with the Richmond walks. But then the entire time that I'm volunteering for them, and I'm realizing they come in on walk day, take the money and leave back out. So you get to learn little inside things about what's really going on behind the scenes.
They're taking their photo ops and they out, huh?
Yeah, I'm like, what part of the game is that? And so then it was like, okay, we don't provide any assistance other than for research. I'm like, hold up. How many years you've been getting billions of dollars for research from the government? And we got people that need help now? That wasn't sitting well in my spirit.
You feel like the money should be designated in different ways.
Right. People need help with their medical bills, a copay to the doctor, prescriptions. You have families of young survivors that want to go to college, can't afford to because they got these exorbitant medical expenses.
Right.
So I pretty much told them, next year when we do this walk, the funds is going towards services that could directly impact the survivors. Oh, we don't do that, Chastity. There's no way. I'm saying you may not do that, but Chastity's going to do that.
That's right. You may not do that, but we're going to be
able to do that.
March. And you may not do that, but
and so I founded Social Butterflies Foundation, October 5th, 2018.
All right.
And it was like, I just couldn't understand because people would come to me because now I had become this face without trying to become the face in this area. And people were trusting me, like, we helping raise money for this organization. I call and ask for help and they turn me away. I'm like, no. So it was a need. We had to fill those gaps. So Social Butterflies we don't just help lupus patients. We also help fibromyalgia because fibromyalgia was underrepresented as well.
Mm-hmm.
Are they linked together, or how do those two
A lot of times people with lupus will have fibromyalgia.
Mm-hmm.
And vice versa. Someone can have fibromyalgia and later on get diagnosed. I call them cousins.
Okay.
I call them cousins. Both of them have the same symbol, the butterfly, and a lot of the same symptoms. The only thing is with fibromyalgia, it's widespread muscle pain. They don't have the organs affected, but they do suffer from like severe depression, anxiety issues. Just hugging someone with fibromyalgia could hurt them.
What?
Exactly. Their body hurts all the time, like just nonstop pain. Chronic pain. It's different from the pain that I feel because I have chronic pain, but I can get a massage to help relieve it. Whereas a massage could be more painful for them, so they won't get a massage.
They don't want to be touched, right?
No. No. So Social Butterflies helps lupus survivors and fibromyalgia survivors and the families. And I say the families because families are enduring it with us.
So tell us about the foundation. I know you mentioned just a little bit in terms of kind of the why, but tell us a little bit about what you do with the foundation.
With the foundation, we provide those direct services such as we have emergency financial assistance. Nobody should have to choose between getting their prescriptions or going to see the doctor and paying their rent or their light bill. And a lot of times people are faced with that issue. They don't have the money to go to the doctor. Or if you go to the doctor and your insurance is not good, which is a really big problem. If the insurance is not good, they're not covering enough of the bill. So that leaves that copay they have to pay. And everybody knows if you owe your doctor money and you need to go in to see him, they want you to pay that bill before you go see him. Everybody's not as fortunate. So we help with that. We have support groups for the youth and the adults. And with the support group, we focus on the mind, body, and the spirit. So we do things to help us mentally, like being out in nature. You wouldn't think that being out in nature is something that will help you with your mental anxieties or things of that nature. And so we went to the Virginia Living Museum and we got to see a planetarium show. And we had an animal encounter. We did the escape room. With the escape room, it was funny because everybody didn't know each other, because there were some new members. So we got to know each other and you have to work together. So it's teaching you how to work together. Take your mind off of your problems and you work together to solve this problem. I didn't get to escape. I needed like 5-10 more minutes. That would have been good. Art therapy.
Psychologist.
Love art therapy.
I'm not interested in going in any rooms.
That's how I was until I went in there. I said, "Oh, okay." It's different. You got to try at least one. At least one time. Got to try it. And
I never peer pressure.
Gosh. And
but
so
I like to see other people live and do their things. I like options, people.
Right.
Like you said, being out in nature will cause me anxiety because I don't like to do bugs. I don't like a lot of, but I like control. Like, so beaches is a good part of nature. Like there's certain aspects of nature. Like my backyard.
See, being near the water is therapeutic.
Yes, indeed.
We do art therapy. So we've had different people come in and we'll paint. We did a painting of like the color purple, the part where they're in the field. We did that. We had someone, she actually created puzzle pieces off of our logo. And so you paint the puzzle piece and you put it together. something that keeps you mentally stimulated and keep your mind off of what you're going through. So the support groups are real fun. We have our summit and health fairs where we unite the medical community as well as other organizations in the community so people can know what resources are available to them. And so we can learn different ways to manage and live a healthy life despite our diagnosis. I tell everybody it's a diagnosis. It's not a sentence.
It's not a death.
Exactly. It's not a sentence. So remember in the beginning, at least I know what I'm going to die from, right? So grandmama whipped that out of me like, girl.
Let me tell you what I'm live with.
Exactly.
Die from. She changed the narrative. She pivoted.
That's it.
She did. Yep, you got to. And what else we do? We have our wig outreach program. A lot of times lupus come on, it affects your skin. So your scalp is part of your skin. So you can lose your hair. And if it's not the illness, it's the medications.
And the chemo and all that kind of stuff.
Exactly. So we have a wig outreach program, but it doesn't just focus on the wigs. We try to get people to understand the beauty within themselves. You know, so it's like we'll have different people come. Right.
Yeah.
And then we have our care outreach. The care outreach helps people. Let's say you're celebrating a milestone. We're going to celebrate with you because we care. Say you're in a hospital. A lot of times when you're in a hospital, I sat and watched my husband. He's in the hospital. You're going to get your hospital food, but they have to go out and go find them something to eat. We want to be there to help them out during their time. One of the times I was in rehab, there was a woman and her husband had to have emergency surgery on his brain because they got into an accident. They was visiting from West Point, Virginia area or something. And he got into an accident on the beach. And unexpected, they had to stay in the rehab room and they charged her to stay in the room with them. She had to try to get clothes, food, and wait for her kids to be able to get to them. I'm like, gosh, but that's a reality.
Yeah.
Things like that happen. So I'm like, we got to show that we care. So we're there for you. So we have those programs. And during the holidays, we adopt families. Because again, medical expenses are so bad. Last thing a lupus or fibro survivor wants is to not be able to get anything for their child for the holidays.
Exactly.
That's a level of guilt for a parent. Yes, indeed.
Oh God, yeah.
Yeah. So how can people support your organization? Because I'm thinking of all of the wonderful things that you're doing, the social emotional piece and just the financial support. How can people support what you're doing?
Well, we do need volunteers. That's always good. Spreading word of mouth and support our events. Like we did the Color Purple in December. We had a preview before it even came out to the public. So we do movie fundraisers. We have our Butterfly Walk for Lupus and Fibro coming up on August 3rd. And we're trendsetters. Normally walks are outside for lupus, the other organizations. But what did I tell you about the sun? It's not good for us. So we're moving our walk indoors to Boo Williams Sportsplex. So we get to walk in air conditioning. So we need volunteers. We need people to register and come out and walk with us. Registration is only $35, but it includes your walk shirt. And it's also going towards all those free programs and services that we offer. So you're helping someone. So it's like, help us, help others. We still got some vendor opportunities left. We're looking for authors or if you're a business that have something. But if you want to support, you could go to socialbutterfliesfoundation.org and you'll find out all the information about our upcoming events and about the Butterfly Walk and register.
So that's socialbutterfliesfoundation.org.
Yes.
Oh, that's a long name.
Love.
You got a big purpose.
It's a big purpose.
Social Butterflies Foundation.org. Social Butterflies Foundation.org. And I say it again so that our people out there listening can get it. Socialbutterfliesfoundation.org. And that's flies. It's a plural, y'all. It's plural. Flies. Butterflies.
Okay? Yes, butterflies. Yes.
It's plural. You can follow us on social media too. Yes. We're on Facebook, Instagram. Type Social Butterflies Foundation in and you'll see us.
And people will be able to donate to you from that actual website.
Yes, you can. You can donate. You can even do monthly recurring donations. I have one gentleman that sends us $5 a month. He's been doing it for the past 3 years. But that $5 a month helps.
Yes,
that's a copay.
Yes, indeed. What a blessing.
Yes.
It is.
Exactly. Every little bit helps people. So definitely, I'm just impressed. Just knowing Chaz, what she's been doing and everything or whatever. It's absolutely amazing, and just to hear the backstory. Like I said, you didn't want to tell people at first, but now you realize that your story is certainly blessing others. So thank you, so much for. Coming on the show and sitting at the table with us and really giving the backstory to Social Butterflies and all and what we know. And here, some of us just know you as a cake lady. You bake those cakes for everybody. There's a story with the cake lady.
Cake and cookies.
Yes. So many different things. So many different We are definitely thankful to have you here. And we will have to have you back as you continue to build and grow your foundation.
Exactly.
Yes,
and when is this walking? You said August the
August the 3rd.
August the 3rd.
It's also my birthday weekend, so you got to come help me celebrate. August the 3rd.
August the 3rd. And to find out information, go to socialbutterfliesfoundation.org.
Yes,
indeed.
Yeah, well, thank you so much for joining us right here at the table. To you, Chaz, thank you so much. And to our listening audience, we always say thank you. We are forever grateful every time we have a moment to be with you all right here at the table. And I am Dr. Richard Mason.
I am Dr. Tamara Williams.
And we are right here at WHOB 88.1 FM.
The essence of HU.
Keep your fork.
Someday we'll be able to measure the power of words. I think they are things. I think they get on the walls. They get in your wallpaper. They get in your rugs, in your upholstery, in your clothes, and finally into you.
Thank you for joining us at the table.
Tune in next Sunday at 1 p.m. for more delicious topical recipes for life on the Sunday Brunch.
On Smooth 88.1 WHOV.